Chronic kidney disease can steal precious time from our cats, but with the right care, you can slow it down and even add happy, healthy years to your cat's life. In this video, I'm going to go over exactly how to do it. If you're new here, welcome. I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the video so I can create more content like it. Before we jump into the 4 simple steps to extend your cat's lifespan, let's quickly review what chronic kidney disease is. Unfortunately, it's one of the most common diseases in our senior cats, and it happens when the kidneys slowly lose their ability to do their job over time. This job includes filtering waste out of the blood, balancing fluids, and some hormone production. When the kidneys struggle, toxins may build up and your cat may feel sick, tired, or even lose weight. They often drink more water, urinate more, and some become more withdrawn. The good news is that true chronic kidney disease usually progresses slowly. Even better, with the right care, when caught early, many cats can live happy and comfortably for years with chronic kidney disease. Let's talk about what that care looks like. One of the most important steps to extending your cat's lifespan is good hydration. And I feel like I am telling the story of Little Red Riding Hood here when I start talking about not too much, just enough, not enough. But the reality is hydration is actually a very specific, well-regulated bodily function when the kidneys are working normally. So hydration, or balance of the water in the body, affects everything from weight to appetite to bowel movements. A dehydrated cat feels crummy. Consider the difference between a raisin and a grape. One is healthy, plump, full of life. The other one's shriveled and lifeless. Now, think about your cat's body. If the cells are shriveled, do you think they're going to work properly? Probably not. Sometimes this shows up as something called a delayed skin tent. So basically when you kind of grab that scruff area behind your cat's shoulder blades and pick it up, if your cat's hydrated, it should pop right back. If they're dehydrated, a lot of times it will stay standing or stay tented. Now that does depend on the amount of fat your cat has and other things, but if you get used to what your cat's normal skin tent looks like, if it's prolonged or abnormal, your cat is likely dehydrated. Sometimes it can be felt when you touch the gums. The gums should be a nice pink bubblegum color and feel a little bit slimy. When they're sticky or tacky, we're usually talking about dehydration. Then consider the gut. If the cells that line the stomach and the intestines are shriveled and dry, motility is not going to work normally. In other words, food does not move through the system like it should. That can then lead to constipation, which then can cause a decreased appetite or even vomiting. All of that can lead to weight loss, and it becomes a vicious cycle. Dehydration can also cause additional damage to the kidneys. The kidneys need a very specific water balance to function appropriately. They're an organ that is basically in this capsule. So if you think of a kidney bean, that's the most common picture that we get when we talk about kidneys, but there's a capsule around the outside of them that doesn't stretch very well. So when you're dehydrated, that capsule can shrink in, but when you're overhydrated, that capsule can only expand so much. So we really need that balance to be pretty ideal. When dehydration is present, the best case scenario is your cat may have a headache. We know that happens in people. Worst case scenario, if your cat's dehydrated, it damages the kidneys more, we have motility issues, and this just spirals out of control. There are a variety of different ways to help your cat stay hydrated. That can include things like a water fountain, multiple water bowls. Some cats are attracted to water that has ice cubes floating in it or even toys floating in it sometimes. There's flavored water and hydration supplements. Some cats, you need to go so far as doing subcutaneous fluid therapy. The list goes on and on and on. We really try very hard to keep our cats hydrated and drinking. If your cat will eat enough canned food or moist food to maintain their weight, that can be a tool in your tool belt as well. However, if your cat is a kibble junkie or a dry food junkie, you may need to work with that. Beating yourself up because your cat prefers dry food is not going to help anyone. How you approach hydration depends on where your cat is in this journey. You need to look at things like lab testing, litter box habits, and regular physical examinations. Speaking of which, this isn't necessarily one of the things I listed on my 4 steps, But regular veterinary examinations and monitoring is incredibly important in the face of chronic kidney disease. It really is next to impossible to monitor chronic kidney disease itself and adjust your management strategies if we don't have routine lab screenings like blood work, urine screenings, blood pressures. And that physical exam is more important than you think. We can tell a lot by laying hands on a cat. So as much as some of our cats don't appreciate going to the clinic, and maybe that's a cat that would do better with a home veterinarian, we do need to come to the conclusion that chronic kidney disease requires routine monitoring if we're going to do what's best for our cats and try and extend their lifespan with that information. Okay, next up, let's talk about a kidney-friendly diet. While there are all sorts of wild and differing opinions on the internet, scientific research consistently shows that a diet that is formulated to be easy on the kidneys not only increases lifespan, but quality of life for these cats. But what does that look like? It can include things like a food lower in phosphorus. And this may be a food that is lower in phosphorus than the one your cat is currently eating, or it may be one so dramatically lowered in phosphorus that it doesn't meet AFCO feed levels anymore. It really does depend on your cat. These foods should also have high quality but appropriate levels of protein, lower sodium levels, added potassium, added omega fatty acids, and appropriate fiber levels. There's a lot that goes into a so-called kidney-friendly food. And of course, the bigger elephant in the room is convincing your cat that they should eat the perfect food. Don't worry, I get it. Cats can be really difficult when it comes to this subject. But I'd encourage you to put up a good fight with this one. Some cats will easily change foods. Others are an absolute hard no, we're not touching anything. For those that are in between, there's again all sorts of tips and tricks that we can use. Sometimes we need to enhance the smell of it, or the temperature of the food, or change the texture a little bit. Oftentimes we can very, very slowly mix two foods together and transition to the one that we want. Sometimes we have to go full bore and use an appetite stimulant. I know sometimes medications can be scary, but if it means a benefit in the long run, sometimes it's worth doing it. Other things that can be tried is the dish you're offering it in, the location you're offering it in, the actual form of the food, canned versus dry. There's so many ways we can try and work with our cats and their food preferences, but the take-home message is it is worth fighting this battle. On the flip side, however, is that it is not worth fighting this battle to the point that your cat refuses to eat. A cat will absolutely starve themselves to death. They're really not the brightest creature when it comes to that. So eating something, whether it's the food you wanted them to or not, is far better than eating nothing. Long-term weight loss is a much more deadly process than kidney disease is. So in an ideal world, we convince our cats that this kidney-friendly diet is the way to go, and it's a super simple way to manage chronic kidney disease, particularly in some of our earlier stages. Worst case scenario, we can't convince them of that, but it is so important that you keep your cat eating. So again, another balancing act, and cats aren't making it easy, but kidney-friendly diets can really make a huge difference in your cat's lifespan if they will play nice with us. A step that often gets forgotten in extending your cat's lifespan is pain control. In its simplest sense, long-term pain is not fun. It will make the most optimistic person you know crabby. Long-term pain also puts stress on the body and has other consequences. This pain may be from arthritis, it may be urinary stones, or even dental disease. But no matter the source, it will affect your cat's quality of life. They won't be as active, their food and water intake may decrease because they may not want to walk to their food and water bowl. You may get secondary constipation, they may just seem old or dull. We want our senior kitties, chronic kidney disease or not, to have pain control so that they can act like a more normal cat. As much as we can control it, we want all functions to be normal. And that includes the ability to comfortably get up and go to that food and water bowl. Now, we do have to be a little bit more careful with our pain control options when it comes to a cat with chronic kidney disease, but that doesn't mean it can't be done. Options include anti-inflammatories and pain medications, PEMF therapy, laser therapies, and the list goes on. It really is about having this conversation with your veterinarian, determining where your cat is at in their journey and what sources of pain we may have, and coming up with a plan that addresses those pain points while protecting the kidneys. Suffice it to say, pain control is huge in extending our cat's quality and quantity of life. The last step I want to address in this video is infections. The most common infection we want to prevent and treat is dental disease. Yes, dental disease is an infection. It really surprises me how many times I will be doing a physical exam on a client's cat, and I will point out that they have dental disease. We'll talk about it a little bit, I'll finish my examination, and at the end of the appointment, they'll say, "So they're really healthy, aren't they?" And I have to pause and say, no, in fact, they're not healthy if they have dental disease. Just because we can't see the disease without looking in their mouth doesn't mean it's not there. That tartar creating the dental disease is a bacterial infection, and it may move into the bloodstream and it can settle out in areas like the kidneys. Preventing and treating infections is another big component to extending our cat's lifespan. Cats with CKD are also prone to bladder and kidney infections regardless of dental disease. So regularly screening for these infections and treating them when present and appropriately can prevent emergency visits in the long run. So there you have it. 4 very important steps to take for your cat with chronic kidney disease so that we can extend their lifespan and the quality of that lifespan. To summarize, they include hydration, a kidney-friendly food, pain control, and infection prevention or treatment. You don't have to be perfect to make a difference. Even small actions done consistently have the potential to make a huge impact on your cat. Most importantly, don't forget to enjoy your cat. I know this can be an incredibly stressful situation, but constantly worrying about what might happen or what's to come in the future is robbing you of the joy of enjoying your cat right now. Don't forget to love your cat in this present moment. You're doing incredible things by showing up here and learning. If you found this video helpful, let me know in the comments below. Say hi, tell me the name and age of your CKD cat, and then go ahead and check out my other videos. Those videos will help answer your other questions about CKD.